Together we achieve victory over heart failure.
Hello and welcome. This is Dr. Vikas Reddy, consultant cardiologist at Citizen Hospital, Hyderabad. So today I am doing this podcast to bring the awareness on the heart failure. As you all know that heart failure is a major epidemic in India and also in the world. It is usually considered as a silent epidemic. I would like to elaborate what are the signs and symptoms of heart failure and how to prevent and how to diagnose the heart failure. So first, very questions about the heart failure. Heart failure is nothing but it's a disease of the heart where the heart fails to pump adequate blood supply to the body. So usually in the medical terminology, we use ejection fraction, which is a surrogate marker for the heart failure. Ejection fraction means it is the force with which heart has to contract to maintain the adequate blood supply to the body. So normally ejection fraction will be like 50 to 70% for a normal healthy individual. In case of heart failure, it is usually less than 50%. So whenever a patient or a person has the ejection fraction of less than 50%, we label them as a person with the heart failure. Second, that most of the Indians are affected by the heart failure, and what is the reason for this epidemic rapid progression in India? So in India, I think the genetics play a most important role. Apart from genetics, most of our population, the India is the capital of the diabetes in the world, and majority of population are hypertensive, obesity, and most of them, especially the males, they have the risk of developing the smoking. So that's the reason why Indians are more prone for the heart failure. So next come to what are the signs and symptoms of the heart failure. So the most common symptom with which the patient comes with the heart failure is the swelling of the legs, pedal edema, difficulty in breathing, palpitations, that is the feeling of one's own heartbeat, fatigue, as well as the weakness. And even the heart failure patient have the loss of appetite as well as the vomiting. So how do you protect as well as how do you save one from the heart failure? Most important step is the prevention of the heart failure. So when someone develop a heart attack, they need to treat immediately. Don't delay the heart attack treatment. And secondly, do go for the regular health checkups. Try to maintain the adequate sugar controls. Try to maintain the adequate cholesterol levels. Try to control your BP. By controlling the risk factors for the heart diseases, I think we can prevent the heart failure in majority of the population. And last, what comes after the heart failure diagnosis? Usually, when someone is diagnosed with a heart failure, the next step is obviously the treatment. So we need the cause of the heart failure. Suppose if a heart failure is because of a heart attack, we need to treat the heart attack by placing adequate stents and proper medical management. Secondly, we need to counsel the patients to stop the smoking and to control the diabetes as well as the hypertension. And when come to the treatment aspect, a variety of modern treatment tablets as well as the devices are available for the heart failure, of which the guideline directed medical therapy is the proven treatment for the heart failure. By the GDMT, majority of the patients can recover from the heart failure. Suppose if the patients still on GDMT, if they keep on continuing the heart failure, that the modern devices like pacemaker, implantable cardiovascular defibrillator, chronic or cardiac resynchronization therapies, we call it as a CRTTs, and these are the devices which helps in improving the quality of life of the patient, though sometimes it the progression of the heart failure. And last, if all these modalities are not working, the treatment of choice is the cardiac transplantation. We call it as a normal heart transplantation, and that is the final result in majority of the population. And through this podcast, I would like to bring awareness that please enroll yourself for the organ transplantation, like organ donor, so that if someone needs heart transplant, it is easily available in India and we can do the heart transplantation. So the lifetime risk of developing the heart failure is 1 in 5 for both men and women. So my advice is awareness is very important. Take proactive measures in healthy lifestyle as well as the stop smoking, alcoholism, maintain the adequate cholesterol and glucose levels. With this, one can combat the heart failure and they have a good quality of life. Thank you.